Saul Marquez with the Outcomes Rocket, and today at the MedTech Innovator Challenge, I have an outstanding guest with me. He's just come out of his pitch, and it's exciting to have Stan Marett, president of MR3 Health, with me. Stan, why don't you give us a little bit of background on yourself and tell us a little bit about MR3 and how you guys are really solving for healthcare challenges.
Okay, great. Yeah, well, myself, my background is healthcare IT, so I have a master's in computer science and have spent all that energy in the healthcare space for a number of years. MR3 Health is about monitoring patients' health at home to keep them out of the doctor's office and capturing things at home that keep them out of acute predicaments that would put them in the emergency room or the hospital. So it's all about prevention. That's really what we're focused on, and on chronic diseases, which is what Medicare is paying for these days.
Fascinating. So tell us a little bit about how MR3 is different than a lot of the solutions that are out there already.
A couple of things. One is we have our own proprietary device that fits in the space that I just described, that works to prevent diabetic foot ulcers for diabetics that have problems with their feet. So with that's one uniqueness that sets us apart. We have patented and FDA cleared device in that space. Separate with that, in the broader remote patient monitoring world, we've got some. Our team and our tools that we've put together are unique to us. They're not something we've acquired or from someplace else, so that we can really differentiate ourselves in the service that we provide.
Got it. So honing into the device, what is it and how exactly does it work to, you said, prevent diabetic foot ulcer? How does that work?
Okay, so we measure temperature on the bottom of the feet, and so the podiatrists have come up with a methodology of capturing 6 spots on each foot to determine what's going on with the health of the foot. So if they detect an elevated temperature over the course of a couple of days, that's an early warning sign that something is going wrong and needs to be physically examined.
Got it. Fantastic. And who is delivering these measurements? Is it the patient doing it themselves, or is it somebody that comes to the home to address it?
Yeah, no, these are very user-friendly, easy-to-use tools. The patient does it themselves, whether it's our device or other devices. We'll train the patient initially with our own clinician, and then the rest of it's real easy. If they need help, we have an 800 number. We can answer their questions over the phone, so it doesn't require ongoing personal intervention. So it's patient friendly.
Got it. Fantastic. And so as you guys have approached the market with the device and your solutions, what have you found has resonated the most with the value that you guys are adding?
Well, from the patient perspective, of course, 2 things. Our sales pitch is to save money. We're keeping costs out of the system. So the people footing the bill for what's being done, the patient doesn't pay anything. So they're saving money. But the patient in particular enjoys our service because they draw comfort from the fact that someone cares enough about them to be monitoring what's going on with them, and they just really appreciate that.
So it's a satisfaction thing for patients, convenience. You go to their home. Who's actually delivering the care?
Yeah, so we're monitoring, and then if there's a condition that deserves an alert, that alert goes to a clinician who then decides what course of action to take.
Fantastic. So given we discussed before this, the Medicare's approach toward funding chronic condition monitoring, you're focusing this on chronic conditions. Can you expand on the conditions that you guys are monitoring for?
Sure. So there's big 4 that Medicare is interested in is hypertension, diabetes, COPD, and congestive heart failure. So the biggest one of those is high blood pressure, but diabetes is probably more of our sweet spot. That's the number 2 in Medicare's mind.
Fantastic. Thanks for sharing that. So what inspires your work in this space?
Well, personally, like I said, I've been in healthcare for a long time, so seeing all the parts and pieces come together to be able to use technology to focus on prevention. The industry's talked about prevention for a long time, but has been reluctant to fund things that actually prevented worse things from happening further down the road. The vision within healthcare has changed, so better outcomes and lower cost drives prevention, and so that motivates us to do a good job.
It's a great motivator, Sam. And as the listeners and viewers are tuning in, what would your call to action be? Whether it be to a provider, executive listening to this, a payer thinking about population health, or even an employer thinking about their patients, their employees. What's your call to action to them, and where can they go and learn more from you?
Okay. Well, I think they should look at their data, look at what their occurrence of these chronic conditions are amongst their population of patients or employees or whoever it is. And if they see opportunities there, if they may be surprised at the magnitude of the occurrence of these chronic conditions, and they can go to our website, MR3Health.com, and we'll be happy to respond to them.
Stan, I really appreciate your insights here today, and definitely wish you the best here at the event.